Good evening, everyone, and welcome. My name is Jessica Drude Paz, and I serve as a clinical psychologist and director of mindfulness programs for UC Irvine's Susan Samueli Integrative Health Institute. I'm delighted to be your host this evening, and thank you for joining us for our August edition of Integrative Insider Live. Although we are all used to virtual events by now, I want to review a few quick tips before the session. Please note we are recording this session. In this webinar, participants remain on mute and hidden on the screen. Please use the Q&A box at the bottom of your screen to send in questions, or if you need to communicate with the event host throughout the presentation. We will hold a Q&A session at the end of the presentation. Please clear all distractions. The Institute is proud to provide this free community lecture. We have multiple clinics located throughout Orange County. Our main clinic is in Costa Mesa off Bristol. We have integrative services at UCI health sites in Newport Beach near Fashion Island, Pacific Breast and Oncology Hematology at Pacific Medical Plaza in Costa Mesa, Yorba Linda, and we recently opened our newest location in Laguna Hills. This is the third and final of our three-part summer series, launching our Mind, Brain, Body Wellbeing program. In this program, we treat a multitude of conditions, such as stress, anxiety, depression, sleep, and memory issues, post-concussive symptoms, headaches, lack of concentration, and chronic pain. We take a personalized approach to assessing and improving mental health, brain function, and emotional self-regulation. Now on to the main event. Tonight, we have the pleasure of hearing from Dr. Darlene Lee, a licensed naturopathic doctor whose clinical interests include mental health concerns such as anxiety and depression, autoimmune disorders, cardiometabolic health, thyroid, reproductive stress hormone imbalances, digestive disorders, and community medicine. She is board certified in biofeedback and now leads the Integrative Biofeedback program at the Susan Samueli Integrative Health Institute, where she uses this approach to help patients with stress-related concerns such as hypertension, insomnia, anxiety, irritable bowel syndrome, and pain. Dr. Lee came to naturopathic medicine after a previous career in social work in the nonprofit sector, where she addressed issues related to health and social justice for more than 15 years. She earned her doctorate in naturopathic medicine from Bastyr University, California, and completed a 2-year residency program at the Samueli Institute. Dr. Lee also holds an undergraduate degree in molecular and cell biology from UC Berkeley and a Master of Social Work degree from the University of Washington. She sees patients at our main clinic in Costa Mesa and the UCI Health Yorba Linda multi-specialty clinic. Please join me in welcoming Dr. Darlene Lee to this evening's Integrative Insider Live.
Thanks so much, Dr. Drude Paz, for that introduction. So I'm going to be speaking tonight. It's wonderful to be with you all. And as Dr. Drude Paz said, I'm going to be speaking to the body aspect of the Mind, Brain, Body Wellbeing program. But as you've probably heard from the other speakers, there's so much overlap between those things. So you'll see that I'm actually going to be talking about mind, brain, and body, but focusing a little bit more on the body. So there's just this really interplay between all three of them, as I'm sure will be evident. So tonight I'm going to be focusing a lot on stress and the impact on the body. And we're going to be talking about a set of strategies that we can use to control, to some degree, how chronic stress impacts the body. So we're really going to be thinking through, okay, what are tools that we can develop for everybody, skills and tools to really reduce the impact of chronic stress. I'm going to be introducing something called biofeedback as a means to do that, to really control how stress impacts our physiology. And specifically, I'll be talking more about how somatic or body awareness can contribute to controlling stress, and teaching some simple techniques that are based in biofeedback that you can use anywhere, anytime. So let's start first by just defining what stress is. It's a word we hear a lot, probably on a daily basis these days, especially in the last year and a half. So let's just get more specific about what we mean when we talk about stress. So one of the pioneers in stress research, Dr. Hans Selye, defined stress as the non-specific response of the body to any demand upon it. So really, when we talk about stress, stress is an experience. Anytime we perceive some threat to our well-being, whether that be mental, physical, emotional, or spiritual, what happens in our body and what happens in our physiology is the experience of stress. So stressors are these perceived threats or dangers, and those can be real threats to our physical well-being, or they could just be things that we perceive to be a stressor. So they can be real or imagined. So that could be an actual physical threat or just the demands of life, the demands of our personal relationships, our responsibilities, etc. So really, stress can be something like a lion chasing you, or it could be something as simple as receiving a text message that triggers this perception of threat or danger, worry, etc. So just distinguishing between stressors being those perceived threats or dangers, and stress as being this overall experience of what happens in our body. So we're going to go into a little bit more detail in this process and talk a little bit more, particularly about chronic stress, because it does impact us in many ways. Okay, so just very briefly covering an overview of what happens in the body with this experience of stress. So it all starts in the mind when we sense a threat or perceive something as a threat or a danger. And what happens is a part of the brain called the amygdala is signaled. The amygdala is part of the limbic system and a part of this older part of our brain, sort of the reptilian or lizard part of our brain that is part of our fear center. So this part of the brain sends a signal to another part of the brain, the hypothalamus, which then sets off a couple of different cascades of events. So we're starting down two different pathways. And what the body is basically trying to do is restore homeostasis. So the end result is that these two pathways of signaling in the body release stress hormones or chemicals that really get us ready to respond to the stressor. This means that our heart rate is going to go up, our blood pressure will go up, many other things along with that. Our pupils will dilate, our muscles will tense, etc. And we need this response. Obviously, we need to be able to respond to threats or danger, and all of these things evolved for a reason. However, if the stressors are constant, either stressors are very frequent or they're just very long in duration, then stress becomes a little bit more of a chronic experience, and that's what we want to try to avoid. So I have here listed some of the consequences of chronic stress. So the effects of stress on the body are very wide-ranging. So they can range from affecting our sleep, just making us feel more tense, irritable, affect our ability to concentrate, make us more tired, lower our mood, to, very physical symptoms where we feel that in terms of our muscle tension. And as I talked about before, just elevating our heart rate, our blood pressure, our blood sugar, etc. It can affect our GI system, and we may feel that in terms of an upset stomach. We may get sick more often, or other symptoms that we had before may tend to get worse. So all of these are the reasons why we need to have skills and tools to respond to stressors as they arrive, and to be able to have more control over our stress response. Because sometimes the stressors don't end, as is the case with the last year. So it's all about developing tools to respond more effectively to stress and stressors. So this is something that I like to show sometimes to patients, but also in any setting where we're talking about stress, because I think sometimes we think of stress as being sort of this unconditionally negative thing. But I want to remind us that not all stress is bad, that we do need a certain amount of stress to motivate us and to keep us engaged and to push us into our peak or our optimal performance. So you'll see, if you can see my cursor down here below, if we were to be in this very low level of tension, we wouldn't be engaged. So I think most people have been in a situation where you need to perform well. So maybe that's taking an exam or being in a job interview, making a presentation. So you need a certain amount of what we call positive stress to be able to push yourself into the zone of optimal performance. Otherwise, you're just bored and kind of unengaged. However, we don't want to move too high along this axis of tension or anxiety, because at that point, it starts to negatively impact your performance. So at that point, we're moving into what we can refer to as distress. So this is our task, to really be able to recognize when we are moving into this higher level of tension, and then to be able to bring it down. So this combination of awareness of what it feels like when we're in that higher level of tension, and then being able to utilize, to reach for different skills and tools that will kind of move us back down into a lower level of tension. So we all need tools for this. So when we reach those extended durations or excessive levels of stress, that's when we begin to see the effects of chronic stress, and that's what we're trying to address. So going back to this idea that stress can be helpful and adaptive up to a certain point, but counterproductive when it's too long or too extreme, knowing that it can help us to stay at this optimal level of activation. So what we might better focus on is just being aware of how we experience stress in our body. So the signs of stress. So I really like to focus on training awareness. So really building this sense of what we're feeling in our bodies. So oftentimes when I work with people, patients related to stress, I'll have people keep a log of how they felt in their body and start to really notice the sensory experience, what people feel when they feel stressed or anxious. And that way we can start to build a greater awareness and build the skill of recognizing the signs of stress in our body, so that we can really tune into when we need to use some of these skills and tools of stress management. So really it's about this awareness of the sensory experience of what we're feeling in our bodies, and then building this toolkit for ourselves of skills that help us to maintain some balance. So again, coming back to this idea of somatic or body awareness, it's a very important principle when we're talking about stress management, and it really overlaps a lot with the concepts and the practices of mindfulness. So there's no better way to be in the present moment than to be noticing the sensations of the body and grounding ourselves in our senses. So we can actually just practice this a little bit now. So everyone, wherever you are, you can just start to feel some of the sensations in your body, and I'll guide you through that. So starting with just feeling the sensations in your hands. So it's a little bit different to feel into the hands than it is to think about your hands. So see if you can really drop into that awareness in your hands and see what you're feeling. So maybe that means you notice the temperature, maybe you feel tingling in the hands. Maybe you notice the sensation of your hands resting on something. So just noticing sensation in the hands. And then switching to your feet. So noticing sensation in your feet, whatever that is for you. Perhaps you notice socks or shoes on your feet, that sensation. Perhaps you notice the temperature. So if your feet are cold or warm, maybe if they're resting on the ground, you have a sense of that, a little bit sense of pressure of your feet resting on something. And then we can switch and feel into the sensation of our belly. So perhaps you feel some hunger, perhaps you can feel this expansion, contraction of the belly as you breathe. So that's just a quick exercise to kind of remind us, okay, what does it mean to feel into the body? And then what we can practice now is just imagine a stressful situation and maybe think of not the most stressful thing in your life, but maybe the number 3 thing, and just see if you notice any changes in terms of the sensations in your body. So where do you start to feel that? Some people might feel a tightening in the belly. Some people might feel some tension starting to increase in their shoulders or their neck. You might notice your heart rate increasing a little bit. So again, it's really important to know what I refer to as those early warning signs when the experience of stress is starting, when there is a stressor, what does that feel like in the body, and really being aware of that. Okay, so going back to what happens in the body with stress. So this cascade of events leads to hormones which activate the fight or flight system in the body, and just kind of calling attention to that. In our autonomic nervous system, we have these 2 arms. One is the fight or flight arm, and one is the rest and digest arm. And this rest and digest arm really kind of balances out this stress response that happens when we perceive threat or danger. So you can think of this as a gas pedal and a brake in the body. So one speeds up the body, the other slows it down, and we need both. So there are a lot of relaxation techniques out there that really encourage this rest and digest part of the nervous system to balance out the fight or flight. So this is just another way to think about how we can effectively respond to stress. It's really about encouraging our parasympathetic part of our nervous system, or this rest and digest part, or really putting the brakes on in our body. So this brings me to biofeedback. So I'll say a few things about biofeedback. Biofeedback's a method of really encouraging somatic awareness, as we talked about. It can help to train this balance in our nervous system, our autonomic nervous system. If you think back to that seesaw. So there's a number of different biofeedback techniques that we can draw upon and kind of keep in our stress toolbox to use. So here at the Institute, I run the Integrative Biofeedback program, and we're all trained as integrative medicine providers. So we really dovetail with a lot of the other services here at the Institute, and we can draw upon other assessments, other specialty testing, et cetera. And our treatments are really coordinated. So that's the context that we're working in. But to say a little bit more about biofeedback, it's really just using some sort of instrumentation to measure aspects of the physiology. So that could be heart rate, that could be sweat on our hands, that could be the temperature on our hands, or brain waves, as is the case with neurofeedback. which I think you've learned about from Dr. Krause. So, and really the idea behind biofeedback is that as we're looking at these things in real time, usually on a computer screen or a tablet or phone of some sort, what we're doing is we're teaching people tools to control what they see on this screen. So really what we're teaching is a way to have more control over the stress response and to be able to control that. So you see this picture here, which is really an image of a biofeedback session where someone has sensors attached to them. They're watching a screen in real time and they're using different skills and tools. So as they're watching this information and learning these tools and practicing these tools, what we're really doing is changing thoughts, changing emotions, changing behavior as a way to influence the physiology. So the idea is that eventually you don't need to be sitting in front of a screen or have these sensors attached to you. You really should be able to make these changes at will. And as you integrate that, that's the most important part of this process, is really generalizing it to situations outside of sessions and really being able to enact these changes without the instruments. So really the goal here is self-regulation, being able to have more control over your emotional and physical response to stress. Okay, so we're gonna use a couple of these tools now and practice a few of them. And I always start in working with any patient with the breath, because the breath really is the foundation of a lot of the practices we use in biofeedback. And I like to think of it as this gateway to the autonomic nervous system. So we can use these practices even without the biofeedback equipment. We can still get the benefits from them. So let's just start by observing the breath. So wherever you are, try to have both of your feet flat on the ground, and you can just rest really lightly, one hand on the chest near your collarbones and one hand on the belly. If you feel comfortable doing so, you can close your eyes. If not, you can just lower your gaze and have a soft gaze. And just tune into the sensation of breathing. So maybe that means you feel the air moving in and out of the nostrils. Maybe that means you feel the movement of the body. So just tune into that experience of breathing. Sometimes just an awareness of the breath can help slow the body down. And then start to notice, in addition to what's moving, is your chest moving, is your belly moving, but also notice the inhales and the exhales. See if you can notice if one is longer than the other. Notice if there's a consistent pattern to your breath. Notice if you're holding the breath at any point in the breath cycle. And notice if the breath feels relatively fast or relatively slow. So just noticing that for a few more moments. Go ahead and open your eyes when you're ready. So as I said, sometimes just having this very simple awareness of the breath is enough to slow us down. But we can take it one step further. And I'm gonna walk you through another technique, which is called diaphragmatic breathing or belly breathing. And this technique really activates the parasympathetic nervous system. So as we were observing the breath just now, I had you notice, do you feel movement in your chest? Do you feel movement in your belly? Do you feel movement in both of those places? So probably, I'm guessing most of us feel it in both the chest and the belly. You feel the chest and the belly move at some point as you're breathing, and that's completely natural. But what we want to focus on with this technique of belly breathing or diaphragmatic breathing is really the movement of the belly. So we want to feel the belly expand as we inhale, as a sign that the diaphragm, one of the major muscles of breathing, is activating or engaging as we breathe. So you can try it now. Let's do it together now. So you can rest a couple hands or one hand on your belly, just nice and relaxed. And just settle into some easy breaths. So in and out of the nose, nice and slow, nice and relaxed. And just see if you can feel that movement of the belly. See if you feel the belly expand as you inhale and then contract and return towards the spine on the exhale. So expansion on the inhale and then returning towards the spine on the exhale. So that should feel really nice, relaxed, and effortless. We're really going for minimal effort here. If you find that you can hear your breath, like you're doing very effortful inhales, like that, little too much effort there. So just try to do that nice and silently, normal size inhales, not very large inhales, in and out of the nose. And that's the practice of diaphragmatic or belly breathing. So it really activates that rest and digest part of the nervous system. Okay, we can take that a step further. We can do slow, very rhythmic breathing using a breath pacer. A breath pacer is a signal that tells us exactly when to inhale and exactly when to exhale so that we can be as precise as possible with this rhythmicity of the breathing. So ideally, we'll be breathing at a rate of approximately 6 breaths a minute, ideally, but that may be different for each person in terms of what feels comfortable. There's a number of different breath pacers out there. I have little icons here on the screen are 2 that I like. One is called exhaler.com. I think it's xhalr.com, and that's online. You can open it in a browser. The other one is called the Breathing Zone, and this is an app. So these are signals that tell us exactly when to inhale and exhale, and adjust it to what feels comfortable to you. But we can try it now just using counting. So you can try breathing with a 5-second inhale and a 5-second exhale. And of course, that's going to be belly breath. So you'll feel that expansion of the belly on the inhale and that return towards the spine on the exhale. So you can try that on your own, but really what we're doing with paced belly breathing or slow paced breathing is trying to influence our heart rate variability. So heart rate variability is just the change in heart rate over time. It's correlated to many different health outcomes. It really reflects the adaptability of your nervous system and shows this balance between the sympathetic and parasympathetic, so between rest and digest and fight or flight. So in terms of biofeedback, we use a type of biofeedback called heart rate variability biofeedback. And this utilizes those exact breathing techniques that we just talked about. So these rhythmic breathing techniques, sometimes we work in different types of imagery, but the idea is we're watching real-time heart rate data as we're breathing in this slow rhythmic fashion. And the aim is to really maximize heart rate variability. What we're doing is really training the nervous system here. So 6 breaths a minute is sort of the average at which we'll find the most autonomic balance and the rate at which we're going to maximize our heart rate variability. But everyone has their own individualized rate. And so when I work with patients, I will do an assessment and figure out, okay, what is the ideal rate at which we find this balance in the nervous system and where heart rate variability is maximized? Because we want heart rate variability to be high. Okay, so I'm going to actually do a quick demo. I have a friend of the Institute in the room with me right now. So I'm going to shut off my camera briefly and turn and share my screen. So I'll stop sharing on this computer and I'll start sharing on this one. Great, that's working. So I'll just show you really quick what we're looking at in a biofeedback session. So I have our friend here of the Institute hooked up to some biofeedback equipment. And what we're looking at is her heart rate and her breathing patterns. And this program that I'm using is showing us a lot of other different measures related to heart rate variability. So I'm going to have you just start breathing some belly breaths. So see if you can do that. So we see this blue line here is her breathing. So she is doing some really nice belly breaths. So that blue line is showing her breath, and then the red line is showing her change in heart rate over time. This looks great. So this is just an example of what we'd be looking at. And as just that simple change in asking her to do belly breathing has shifted her heart rate pattern and how it's changing over time. So it's increasing as she inhales, decreasing as she exhales. So this is just a little bit of a taste of what biofeedback looks like for those of you that are more visual. And so we'd be working with different techniques, different breathing techniques, looking to alter what we see on the screen, and then really looking to cement those skills in a biofeedback session so that we can apply them outside of a session. So really quickly, I'm going to stop sharing this and I'm going to share again. Oops, lost this. I'm going to share my screen again on this one. I just want to highlight how I'm using this, particularly heart rate variability biofeedback in my research. So since the beginning of the pandemic, we've been working with frontline healthcare workers at UCI Medical Center. So from November to May, we implemented a stress management program using heart rate variability biofeedback. So we were comparing heart rate variability biofeedback offered via telemedicine to a program identical program that was offered in person. It was a brief program, so 10 days with 5 either telemedicine or in-person sessions every other day, teaching them the same exact skills that I've been talking to you about this evening. So we're still in the process of analyzing our data, but the preliminary results really affirm that our telemedicine biofeedback intervention was pretty comparable, so not inferior to the in-person intervention. And really both arms of the study showed improvement in measures of stress and mental health. So we're still analyzing that, so stay tuned. But really it's looking very positive right now. In terms of research, I'm also collaborating with some researchers from the School of Nursing. We're launching a pilot study using heart rate variability biofeedback in a homeless population on Skid Row in Los Angeles. So we're launching this pilot study in around a week and a half, and that should be really interesting too. So we're looking at measures of mental health and substance use. So that is about it for me. So I'll stop sharing my screen now.
Great. Well, heroes really do work here, Dr. Lee, and you are one of them. It's an honor to work with you, truly. And that was a fabulous presentation. Thank you so much. After watching that blue line in the demonstration, I'm now very focused on my belly breaths. You'll be happy to know. And I'm happy to be doing that. So thank you. And before we transition to the Q&A, I wanted to share that another element of our mind, brain, body well-being program is yoga therapy and Tai Chi. And while I share about this, I encourage the audience members to type any questions that you may have into our Q&A. But in terms of yoga therapy, so the difference between yoga and yoga therapy is that yoga therapists have 5 times the amount of training as yoga instructors. And so we have been doing free virtual yoga for well-being programs, Mondays through Thursdays. They're an hour long each, and we'll be sending links to all of this information in our follow-up email. But we'd love it if you could join us. These are hour-long classes, again, free through the end of the year, Monday through Thursdays. We're also launching 2 new virtual 6-week yoga therapy classes at the beginning of October. One is yoga therapy for restful sleep, and another is yoga therapy for stress reduction. So yoga therapists are really trained to deal with some specific health conditions. And I also wanted to share a little bit about Tai Chi. It's one of the best known martial arts from ancient China, and it's gained popularity throughout Western countries in recent years. At the end of September, we're launching a 6-week virtual Tai Chi for Wellness class that's really focused on heart and lung health. So if anyone out there is seeing a doctor for heart or lung health, then we'd love to have you in this class if you're interested. I'll include a link to that as well. And we will also share links to our Women's Wellness Day video sessions on Tai Chi and yoga therapy for lower back pain. The intro and practice sessions are only 25 minutes long, and they provide a wonderful introduction to both modalities. So at this time, I'm going to shift to the Q&A, and I see a question in the chat that says, what is the difference between mouth versus nose breathing?
Okay, that's a great question. So there are a lot of differences between mouth breathing and nose breathing. One of the main reasons we want to breathe through the nose is that when we breathe nasally, it warms the air better, which actually can help with gas exchange. It's in general better for the function of the lungs, etc. Interestingly, when we mouth breathe, we tend to take larger breaths than we really need to. Sometimes when we're a little bit more anxious or stressed, we may tend to breathe through the mouth a little bit more. And this can actually, taking larger breaths than we need to can lead to something called overbreathing, which the symptoms of overbreathing sometimes really look very similar to anxiety. So we want to be cautious of mouth versus nose breathing for many reasons, including oral health, etc. But the 2 that I want to highlight are just the filtration of breathing through the nose, the warming of the air, and the importance to the function of the lungs and gas exchange, etc. But also that mouth breathing tends to move us more towards over breathing, which can replicate anxiety. So it also can kind of alter the concentration of different gases in the blood, which can then result in certain symptoms. So those are a couple different things, but comparing mouth and nose breathing. So we want to really focus on nose breathing, particularly on the inhale. We will use certain techniques where we breathe out of the mouth on the exhale. So that is actually better. So on the inhale, we always want to be doing that through the nose, but there are certain techniques where we can extend the exhale and make that a lot longer, and we can do that through the mouth. So we can use something called pursed lips breathing on the exhale, where we actually, it's also called straw breathing. So we can pretend that we're exhaling through an imaginary straw, or we can actually use a straw where we make a very small opening with the mouth and actually sort of force the air out. And what we're doing is really creating this resistance so that the diaphragm is kind of moving back into place very slowly. And that has the result of really putting the brakes on in the body, really activating the parasympathetic nervous system via the vagus nerve. So we can use mouth breathing on the exhale to our benefit but we really, there are a lot of differences between mouth and nose breathing.
Great. Very interesting. Someone else asked, how soon should I expect to see positive changes after practicing breathing techniques?
Okay. Well, I mean, I think that some of you may have noticed that as I said, when you just focus and bring your awareness to the breath, you can feel some immediate effects sometimes, just focusing your awareness there. It depends on what types of positive effects we're talking about. If we're talking about shifts in your heart rate variability, sometimes that can take months, but we can learn a lot more quickly this ability to control our physiology, to really kind of slow the body down, etc. In that process of practicing some of these breathing techniques, we are building this power, this strength of the parasympathetic nervous system. And you will notice that effect, sometimes immediately as you're using the techniques. But in terms of being able to apply them, that kind of depends on how often you're practicing. So it depends really what we're talking about. If we're talking about some of these physiologic measures, sometimes it takes a number of months, sometimes, 3 months, 4 months, 5 months to really shift heart rate variability measures. But if you're practicing them often and you really integrate that practice and you're able to drop into it very easily, you can see effects more quickly than that. So, practicing them for a week or two may actually get you more attuned to how to breathe that way on a more regular basis. So it really depends what we're talking about.
Great. And it's interesting, this idea of turning toward our stress, I think so often it feels that there's a tendency to turn away from stress, that it's unpleasant, and maybe we it feels like there's a tendency to distract ourselves, right? To maybe turn toward something else, toward our gadgets, toward food, toward substances, like anything rather than like turning toward the stress. And so I'm just curious if you have anything to say on that topic, on turning away and because that seems to be sort of the go-to. And when people turn away from it and try to distract, what ends up happening?
Yeah, I think what I'm thinking about when you're talking about is this, just asking ourselves, like, where am I feeling this, or where am I feeling this in my body? Actually allows us, it doesn't actually make the stress any bigger. It just allows us to feel into it a little bit more. So I think that overlap with mindfulness, and I'm sure you talked about this as well last month, where we can really utilize our senses instead of distracting our senses with other things. So really, really encouraging ourselves to really understand what is our own experience, our sensory experience in the body. But it's true. I think when we try to turn away from the experience of stress, sometimes it has the opposite effect. If we try to distract ourselves or avoid it, sometimes it has the opposite effect of what we're looking for, and the experience of stress actually grows. Whereas when we actually start to notice some of the sensations, it actually seems a little less daunting. That's a couple thoughts on that. I don't know if that resonates with you.
That's great. That's very helpful. Thank you. I think just one last thought too, as I was thinking about, there's an exercise called urge surfing that really teaches us that sensations, they come, but they also go, just like a wave, right? And so I think when we're feeling unpleasant sensations and want to turn away and go to something else, right, it deprives us of that experience of really riding it out, riding out the wave of it coming and going, and seeing that we don't have to turn away to have maybe something end up subsiding.
Yeah, and I think as we start to observe more, we learn over and over again that nothing is permanent, right? That sensation is always shifting, whether that's pain or emotional distress, that experience is always changing, right?
Rather than maybe like labeling it as something permanent, that we can tune into it and realize that it's not. Great. I also see a couple other questions. One is, do you do telehealth visits for heart rate variability biofeedback training?
Oh, great question. Actually, we've really started doing this a lot at the beginning of the pandemic. And yes, we can. The equipment is slightly different. So if people are interested in doing that, I encourage them to buy a heart rate sensor. There's a lot of them available to consumers. I have a couple of favorites, but we can, and the way that works is we just do it over Zoom as we do other telemed visits. And then I have you share your screen as we use a heart rate sensor that's synced to an app on whatever your device is, your tablet or your phone. And that way I can see what's happening on the screen and I can coach you through it. So we can totally do remote heart rate variability biofeedback. And in fact, that's what I was using in my research study with frontline COVID-19 workers. So we were using an app and a sensor that was provided to them, and I was able to just follow that on the screen. So yes.
We're so high tech. Okay, two more. One is how can people sign up for this training with you?
Well, I see patients at the Costa Mesa Clinic and also at Yorba Linda. So you can definitely access the services that way. And
we'll send that in the email, in the follow-up email, like the number to call to make an appointment.
Yeah, thanks.
Great. And then last one is, what other benefits can I expect? Making better judgment, physical changes?
With some of the techniques we talked about? Sure. So, I mean, there's a lot of different effects that you may notice when you start to really cultivate that parasympathetic side of the autonomic nervous system. So that might improve your sleep. So sleep quality, your ability to fall asleep or stay asleep, digestion. So it's the parasympathetic side of the nervous system is called rest and digest. So really that side needs to be really, that part of your nervous system needs to be nice and strong to move effectively and for the GI tract to be moving. You know, it can have a lot of effects on our experience of pain. I think blood pressure is another way that you can see effects. And those are just a couple of different ways, but you know, this balance between the sympathetic and parasympathetic is important to so many systems in the body. So besides just noticing a difference between, you know, a difference in sort of mental, emotional health, et cetera, there's a lot of physical impacts that could result as well. Great.
Well, thank you so much, Dr. Lee. I mean, I know we work together, we've co-presented together, and I still, every time I'm with you, I learn so much. And also, you know, really, you practice what you preach. You know, I know that you bring these practices into your own life and into the lives of so many people. And we're so fortunate to have you at the Samueli-Institute.
Thank you so much. It's a pleasure to be here and to share this with everyone.
Thank you. Thanks for all that you do. And thank you to our audience for joining us for our Integrative Insider Live community lecture. Upon ending the webinar, a pop-up window will have a valuable survey on this evening's event. So please help us improve our community offerings by letting us know what you think. In addition to sending our Women's Wellness Day and Tai Chi and yoga therapy sessions. We'll also be emailing 5 key takeaways from this session and sharing how you can sign up for an appointment with Dr. Lee, as well as the yoga therapy classes and Tai Chi class. So the next Integrative Insider Live is Thursday, October 28th. We will host Dr. Faisal Yafi, the medical director of the Department of Urology Men's Health Program at UC Irvine Health. And he will be presenting Turning Back the Clock, How to Restore Erectile Function. For more information and how to register for our events, please visit our website at ssihi.uci.edu. Thanks again, and we will see you next time. Have a great evening.